Thank you for joining us. We continue on a generally positive track in our recovery from COVID-19. I know I joined a lot of parents throughout San Diego County who were incredibly excited to take our kids back to school this week. I know we're excited about increased capacity at the Padres this weekend, and as we prepare to face off against the Dodgers. And we continue to see progress in our vaccine distribution while our cases remain relatively stable. A slight uptick, which is we've talked about for many weeks, not unexpected, but again, some kind of modest changes, but again, staying in an overall very stable way. We do encourage everyone, continue, utilize a face covering and avoid high-risk settings and continue to be safe. But we are marking a pretty significant milestone in San Diego and across California tomorrow, where the vaccine eligibility will open up to everyone, 16 years and older. And so starting tomorrow, all of those 16 years and older, regardless of where you work or underlying health condition, are eligible to receive a vaccine in San Diego County. Like so many of you, I've waited my turn to get vaccinated. I will become eligible tomorrow, and excited to go to the VA in the morning and get my first shot of the Pfizer vaccine. The system should be open now for people to be able to make appointments. 16 and 17-year-olds are only allowed to get Pfizer, and the system is only supposed to make those appointments available to them. But there will be safety protocols on site to ensure that prospect. But I also want to reiterate that as every time we've opened to a new grouping and every time we've opened a new category, it's going to create a surge of people seeking out vaccines. And so there will be the normal frustration that we've been through multiple times about challenges in getting appointments. And we just ask everyone continue to be patient. We've been through this multiple times. And so now we're essentially opening up the vaccine to everyone in San Diego County starting tomorrow, 16 and older. And we're waiting on more supplies and more vaccines and more people to finish their second dose, which will free up more first dose appointments. So please be patient as we work through this system. On the vaccine front, as was widely discussed yesterday, out of an abundance of caution, and again, this was an abundance of caution, I think, to demonstrate the safety mechanisms and protocols can show something that's of concern. People can take a pause and evaluate it. But the Centers for Disease Control, FDA, California Department of Public Health, all recommended a pause on the administration of the J&J vaccine. The state of California, San Diego County, I think all 50 states followed suit in putting a pause while we await additional information. I just wanted to share with you that this pause is going to have minimal to no substantive impact on our progress moving forward as a region. To date, the J&J vaccine only represents 2.9% of total vaccines administered in San Diego County. It did not disrupt any of the appointments at our county-administered network of sites. They were able to sub in Moderna or Pfizer for anyone, so no one had an appointment canceled. Where the J&J vaccine is causing a slight disruption is in some of our outreach programs, our foot pod teams. These are teams that are out that are doing vaccines. These sites paused what they're doing to make the appropriate changes to sub in Pfizer or Moderna, and they will be resuming on Friday. CAL FIRE moved already yesterday to sub in Pfizer for Moderna for their agriculture workers program, and many of our partners are pivoting to Pfizer for homebound seniors. So there will be some inconvenience there, some kind of readjustment that needs to happen, but we will do that while we await for guidance on the J&J vaccine as we move forward. As it relates to homebound seniors, I did want to share with you the state of California is sending some vaccination strike teams deployed throughout California. We have requested and expect we will get one here in San Diego, and these will be teams that will be assisting in the effort around homebound seniors. Again, it's been a challenging work. We have a lot of providers, a lot of folks working to get to our homebound seniors, and so we're very grateful and appreciative to the state. We don't know exactly when those teams will arrive, but we are confident that they are coming, and we appreciate that help as we try and catch up that critical group of folks to help them get vaccinated. You'll see in a minute, we're going to make some adjustments to our dashboard, our vaccine dashboard. And throughout the pandemic, we've tried to share a lot of information, be very transparent about the information and data we have, and then when there's a reason to make a change in how we report it, also share with you that. CDPH and others have now stated that 75% of your eligible population getting vaccinated is the goal. That is where you want to get to as a region. And to date, our dashboard has really been reflective of the percentage of all San Diegans eligible. And so we're shifting it to represent what percentage of the goal that we're striving to get to we are at. And so it'll give us a little better sense of what we're marching towards, what we're working towards. All of our efforts are designed to get to that 75% number. And so I'll show you what the new dashboard will look like. It should update this afternoon. All of the same data is available, and all of the same data will be reported. We're just changing the configuration or the display on the dashboard again to represent our progress towards the goal of 75% of our population. I also want to note that the information we have on our dashboard does not presently include any information from the VA or the Department of Defense. We are working with the VA to get that data, and we think we will be able to add that in the coming weeks. And I want to thank Congressman Scott Peters and his office for helping us and assisting us with the Department of Defense to get the number of San Diego County residents they are vaccinating, so that as we move forward, hopefully in the near future, we can begin incorporating those numbers in so we can get a clearer picture, more accurate picture, more total picture of what it looks like on our progress to our goal. One other thing I want to point out before we jump into our charts for today, you will note in the reports today a significantly higher number of deaths associated with COVID. 25, I believe, is the number today. It is not because there's a significant spike in deaths recently. All of the data we report is preliminary, and in order to ensure the accuracy of our data, we have a quality assurance process in place that goes back and reviews. And in December and into early January, we had a significant number of fatalities that were going. And as a part of working through some of that data, receiving data from CDPH, reviewing death certificates and other information, there's been, I believe, 21 of the 25 being reported today are actually deaths that occurred in December or January, but have now been ascribed to COVID. And so I don't want that number today to spike out and be a cause for alarm, just more a reflection of the ongoing data quality assurance and follow-up work that our county health team does here. With that, let's jump into our charts for today. The first one you see, this is just the revised dashboard. This should be live in a few hours. What you'll see there on the top left is very significant or similar to what you've seen throughout this: the doses received, doses administered, pending documentation. That's just, we know we've given a shot, it's being uploaded into the system. And then the to be administered is just those that are scheduled in the next 7-day time frame. And so you can see that remains the same. What's a little bit different, you'll see there on the right-hand side, is the goal vaccinated. We know our goal for San Diego County is 2,017,011. That's what we have to get to as a region to hit that 75% threshold, which is what's been outlined to us that we should strive to get to. And so what you'll see there in the two charts is the percentage of that goal with at least one dose. And then on the other chart, you'll see the percentage of that goal who are fully vaccinated. So you'll see we are 60% of the way towards the goal we're striving for, which is 75% with first dose, and 37.5% of the way towards the goal that we want to achieve on fully vaccinated. Next chart, you'll see our cases, again, holding relatively steady. You have days where it blips up and down a little bit, but again, from the beginning, we've never said the day-to-day numbers. It's the trend line over time, and what you see with that purple line there, that's the 14-day rolling percentage of positive average. That is holding very steady and even descending or declining ever so slightly. We're now below 2% on our percentage of positive at 1.9%. So that remains very encouraging. The normal fluctuations in testing. Testing, of course, has gone down. And that is not because it's not available. Just San Diegans are seeking the tests less. But we will continue to ensure that the testing will be available, widely accessible for anyone who would like to get a COVID test. And again, our overall case numbers, up slightly from last week, but again, generally holding very, very steady and encouraging. And then the final chart here is just the reporting of our case rate. For those of you that track this routinely, you've been following this chart for many months now. And you'll see our unadjusted case rate is reported out this week, 6.3. Our adjusted case rate is 6.0. up ever so slightly from last week, but not of any significance or not of any concern. Our testing positivity percentage, roughly the same. You will note that those two numbers on the bottom left there are technically in the red tier, but just to remind you all that last week the state changed the guidance. There is no danger that we would backslide to red simply based on a case count, and so we are comfortably in orange, where we expect to remain until hopefully we see our cases descend more as more people get vaccinated, hopefully into the yellow, and then with anticipation of that June 15th retiring of the tiers.